How you doing again? Ken Allen bringing you the second chapter in the book for EMT 1A. This is AAOS's Emergency Care and Transportation for the Sick and Injured, Workforce, Safety and Wellness. Join me as we go forward. We're going to be talking about safety in terms of things that can harm us in the most basic sense: dirt, grime, viruses, bacteria. But then we're going to get a little deeper and talk about the effects of the job on us, the short term and the long term, what you can expect to start feeling, how it's very important to monitor your own safety while on scene, while you're going to the scene, afterwards, and then in the long term, how are you managing when you're facing these traumas and these heartbreaks and these really difficult, stressful moments time and time again? We will see a lot in this job. It's important that now you start a precedent that you're going to take care of yourself, make the right decisions most of the time, and that you're going to see it through so that you become the victor, not the victim. So we're going to get started now regarding workforce safety and wellness. Chapter 2 is just that, dealing with all of the stuff we're going to see on the job. Yes, fire, but of course, EMS and paramedics and nurses and doctors, all part of the chain of survival. We're going to cover scene safety on a very logical and in a literal sense, and then in a kind of, how would you say, philosophical sense. Personal protective equipment, BSI, your gloves, your goggles, your gown, your mask, if need be. Infectious disease awareness, contamination and decontamination procedures, sanitizing yourself post-call, as well as the ambulance and the equipment that have been used during the call. Physical and mental fitness, stress management, both long and short term. How to think of death and dying on this job and how to manage it. How do you stay joyful in and out of the job? If you're planning on doing this for a full career, you have to be on the lookout for these kinds of hazards that you will be facing as you go forward. On a day-to-day basis, a lot of battalion chiefs will say, I want to make sure that all my crew does a full day of work and goes home safely to their families. That's the first safety precaution and the first parameter we want to meet. After that, start thinking long-term. I want to be able to do this job day in and day out for a career. And I want, even more so than that, to have some time off after I give so much to this career to make it worth my time and what I put my family through, and show them that this does pay off, and show myself that I can use all of that time that I gave up here in the future. Ideally, we can all learn to do that. Is it showing it? Yes. Be on the lookout for that. Scene safety. Consider the hazards you may run into during a vehicle accident. What about a homeless encampment or a meth lab? Caustic, chemical, crime-wise, sharp objects, weather, logistics of getting into a car and cutting someone out. And, oh, by the way, all the traffic around. There's a lot we have to always be aware of as we're doing this. And it's going to cause a lot of physical stress on the call. The simple act of doing this in the attempt to save someone's life is mentally trying on us. And so watch yourself and make sure that you're not sacrificing too much of your own self in order to do this job. So we'll talk quickly about infectious diseases. This is a very literal sense of keeping yourself safe. What's a pathogen? As we talk about medical terminology going forward, we're going to learn to break these terms up. Patho means bad, and gen means creation, generation, or, the first of. So think of a bad creator. A pathogen, in this sense, is a microorganism that can cause disease in us. Exposure would be coming into contact with that disease, microorganism, or toxin. And that can be either directly or indirectly. You touch the infected things, or you touch something that has been touched by that infected thing. That could be a needle or a gurney. And contamination. Have you actually been contaminated? Did you ingest in one way or another those microorganisms? How can we do that? Let's look at the routes at which we could be contaminated. We can be directly contacted. That would be us getting blood in cuts and wounds in our mucous membranes in the conjunctiva of our eyes. It could be an indirect contact, getting a needle stick. It could be touching the gurney from one patient to another, which we really have to be aware of and thus clean the ambulance thoroughly after each call. It could be from airborne transmission. Tuberculosis is one of those. Certain meningitises are another. Winter flus are airborne. Foodborne transmission would be like a Hep B or an E. coli that you get from either undercooked food. Typically, what it means is there's fecal matter inside the food. That's why it's attached to lettuce and salads, because you don't cook that out. Vector-borne transmission, the fleas or the rats or the mosquitoes. That's the major cause of the plague, was the rats that were ubiquitous in Europe, and the fleas that were on the rats spread it to the rats gave it to humans. So we want to minimize any chance of contamination and infection. And so we do this through wearing gloves on every call, goggles on every call if you're diligent, and should be, and then wearing a mask. And for the most part, we're wearing masks on everything post-COVID. It's almost like before AIDS, many people didn't wear gloves. And that was the impetus to start wearing gloves. Now, post-COVID, masks are kind of the norm. If you're in their face, a lot of departments actually have respirators with tanks, and we use that if you were to be anywhere close to the airway. The big couple of things to keep in mind: wear those gloves, wear the proper equipment whenever you go on the call and you need to. And then, very simple, after every call, wash your hands. Every time you go into contact with somebody at the hospital or afterwards, when you drop them off and you come back to the station, wash your hands. And I wash all the way up. I wash up to my arms. I act like I'm a damn old doctor scrubbing in for surgery. They can do it pretty nicely at the hospital. They have foot lever activated sinks, so you can get in deep and really clean the heck out of yourself. And it's just good policy in an ambulance to clean yourself more regularly. We don't know how thorough the crew before us was, and we don't know what's on those seats. So whenever possible, choose to be cleaner than the person before you. Eye protection is important, and you note in this image, the wraparound goggles go beyond this corner of the face. They actually reach around the side of the head to past the temples. That's what you want. These can fit over regular glasses. These can be worn on their own. You can get expensive ones. The department you work for will have a bunch of disposable ones. Those are just fine. You don't have to worry about getting ballistic goggles or anything like if you worked in a war zone. You can get a cheap pair that are disposable. You can get your own prescription goggles and wear those. Make sure that you have something that wraps around the face, however, and that's really going to be the best. It's even better than a face shield. You don't have to worry about putting it up and down, and it works very well. Additionally, the respirator is important. We have a pocket mask as in a little fanny pack. Most firefighters carry. Say you should get caught away from your fire engine or your ambulance. Let's say you're out shopping in a supermarket and someone collapses. It can happen. You hopefully have a radio and your little fanny pack that has basic first aid equipment. Usually mine had a stethoscope, bandages, a tourniquet, some IVs, start kit. It had some Curlex and a pocket mask. I could start CPR on that person and give breaths while I waited for my partner or the crew to come in with the rest of the gear. We will be using oxygen if we arrive in the ambulance or on the apparatus. It'll be in the O2 bag, and it will have not just oxygen, but a bag valve mask that can deliver full oxygen, not exhaled oxygen. That'd be almost 100% that the bag valve mask can give, and only about 19% that we exhale from each breath into the patient. So it's a much better choice to go with 100% oxygen. And, it's going to be better with the bag valve mask because it's a higher concentration, and you eliminate the issue of contamination or biohazard. And then, of course, A sharps container will be used anytime we are penetrating the body with some sharp object. Paramedics use IVs all the time. You shouldn't be coming into contact with IVs. It's not a great policy to have someone pass you a sharp to throw away. What you will be using are glucometry lancets, little stickers that you place on the finger and snap and get a drop of blood to check their blood sugars. Those should also be thrown away inside the sharps container. If you don't have one of these large ones, we have smaller ones that you can use. And then, of course, you're getting immunizations in this class with the understanding that you're going to be riding along in the spring, and you need to be sure that you're protected for that, as well as the patient being protected from anything you could have. Hep B is recommended, as is influenza. Those are your own prerogative. However, MMR, or measles, mumps, rubella, are necessary. The chickenpox vaccine, again, I think it varies county to county if that's a mandatory requirement or not. For the most part, it's usually not because you get chickenpox as a child. A lot of people didn't get it as a child. It's a recommendation that you get the varicella vaccine later in life. If you get chickenpox later in life, it's a much more severe reaction than as a child. And then dip-tet, or the Tdap, the tetanus, diphtheria, and pertussis. And of course, you need to get a skin test for tuberculosis. If it shows up positive, you have to go back in a series of 3. There's actually something called a quantiferin now that allows you to get it and forget about it. It's a one-time use. So let's say you do get exposed. Hey, what do you got there?
I found
Okay, you found JoJo. I got it. Can I finish up here, duders?
also.
Edith,
Wait,
don't touch it. Don't touch it.
I Grammy.
Pomegranate? Pomegranate. Okay, sorry about the interruption. All right, so we have to get our immunizations together as well. Make sure that you do have all of the required MMRs, Tdap. The chickenpox is recommended, but also the tuberculosis. And if you don't have that series of shots current, sometimes you can take what's called quantiferin, and that will give you a one-time shot, and you don't have to go back 3 or 4 times. General exposure issues, if you do get exposed to something, let's say body's blood or fluids like amniotic fluid or vomit or feces or something, sometimes lice, maggots, those are the gross ones. But even tiny ones like tuberculosis and things you can't see, make sure if you think you've been exposed, stop care, hand over the patient to a person of equal training that can manage that call. And then you're going to go immediately and clean the exposed areas with some kind of mitigation substance, usually an antiviral soap or a device that you crack like a brush that cracks open and releases a specific chemical. You wash with that. That is a much stronger bacterial killer. Use something like that to clean yourself off. If it's in your eyes, flush your eyes for at least 20 minutes. Contact your supervisor. They're going to bring over the necessary paperwork. And then you're going to complete this report. Depending on the situation, they're going to bring you to the hospital, test you for the diseases you're at risk for. They will test you a week later, month later, 6 months later, and a year later. And they just continue to see, do you have something wrong that's shown up in that year post that exposure? From what I've been told, exposures and contaminations don't happen that often, especially in modern times with safety locks on the devices, with all of the extra PPE that we wear and the amount of cleaning and sanitizing that we do. They're rarer than before. Keep your ambulance clean. At the end of every call, clean the back of the ambulance. Wipe it all out. And we're using antiviral spray or some kind of solution, or at the very least water and bleach solution that you're going to use to clean the interior of the ambulance within reason. The gurney, take off the bed sheets, wipe down the gurney thoroughly, let it sit, let it disinfect, wipe it down again, potentially. The electrodes for the monitors, clean those off, the blood pressure cuffs, stethoscopes, earpieces, everything you've used. It's not a bad idea to do it when you arrive first on your ambulance in the morning at the beginning of shift. Who knows what the crew before you did? So make sure you're cleaning your gear after every call. Be ready for your first patient. Be ready for your last patient. Clean it after the last patient on shift. Chances are you're not going to have to worry about what's called a nosocomial infection, which is an infection to a patient caused by healthcare workers in one way or another. Usually the hospitals are the ones who report this. Who's to say it didn't happen in an ambulance where the patient, an elderly immunosuppressed patient holding onto the gurney, didn't come into contact with a tuberculome or a meningitis strain and now has contracted some illness due to our improper, lazy sanitary procedures. So on scene, always think about, are my and my partner, the public and the patient, safe? It even begins prior to arriving on scene. When you get dispatched, that's the time that you should be thinking about hazards you're about to go into. You should be putting on the right protective equipment, talking to your partners, getting a game plan on where to park. And then once you get to a stop, you can go to action. It's not a great idea to wait until you arrive to start looking for a place to park and put your gear on. You need to be able to go when you get off the ambulance or the fire engine and continue looking around. Keep your head on a swivel on these calls. You're looking for traffic. Weather can be a concern. There could be people trying to zip around because they're angry. Specific scenes to be concerned with would be violent assaults and crimes. You don't know what a person's going to do when the police are there and they have a record and maybe they're facing jail time. Group gatherings can go south very quickly, depending on the issues going on there. I don't need to tell you right now, we're in a heated social environment and these things can pop off very quickly. Also, keep yourself aware when you're in remote locations, when you've been in the wilderness, or there are villages and people living in remote locations. You have to go down long, deserted roads to get there. That means you're going to need to go back down that road to get out. If you're hustling, it's going to be a bit of an ask for you and your driver, especially hostage situations. Anytime the police are there and they have already pulled their guns, be ready for anything to happen. If it is something like a riot scene and you see riot shields and helmets, be careful. Stay behind the police if at all possible and wait for them to get on scene and manage that first. Anytime there's a mass violence, allow the police to get there first. We will do staging. We'll park a few blocks away where we're close enough to get there in a hurry, but not close enough where people can come over and we are a part of that emergency scene. We want to make sure it's safe enough for us to go in to get our job done. We don't want to get halfway in and then realize we're in danger. We are potentially more patients and we can't do our job to treat patients. When dealing with that, know who's in command. It's usually that chain of command for us would be a captain followed by it could be a lieutenant followed by a captain to a chief. If it's police on scene, pretty much they're in charge. Whoever's got the firearm usually dictates how that scene goes. What do I mean by head on a swivel? Well, do you see the people in the back? Do you see the people walking around behind you? It doesn't take a lot. I've had people suddenly come out of one room and they're carrying a firearm because they're about to seek retaliation for the person we're working on. Suddenly now there's a gun in the picture. Or people can walk up that are potentially the enemy of the one you're working on and try and finish them off if we're about to save their lives. That's happened too. Just things to keep in mind, when you realize if you've worked in places that are sketchy, Afghanistan or Oakland, when people are all drawn to a scene, but you see people running the other way, why are they not coming to see what's going on? And do they have the right idea or are they trying to escape? These are all things to be aware of. Look in the corners of the rooms as you're working. If something starts to pop off, projectiles are flying like Molotov cocktails or bullets, seek cover, find it, and conceal yourself. Oftentimes that means being behind something solid. If you could get behind rock, all the better, or metal. Police is a better decision if you don't have those. So keep that always on your head. Have an exit strategy when you start to feel the hairs on your head go up. What can you do to train for this? Well, the goal is don't get yourself into that situation to begin with. So don't enter it anytime you're concerned or you hear something on the radio that sounds questionable. Stay away. Have additional resources clear that scene for you. Don't go into a scene where there's multiple people laying on the ground unconscious. Something's going on in there that maybe a hazmat crew should detect, see if there's any gas in the environment or if there's a shooter someplace. We want people to clear that scene. And for the most practical reason that we don't want to also become patients another crew has to treat. At the very least, we want to be effective at our job. We don't need to rush in senselessly if we now make the problem worse in the end. Realizing you don't need to be on scene on these calls until it's safe enough for you to enter. Think about trying these steps. And really, this is what our class is about. I'm going to put you under mock stress, but stress nonetheless, where you have to think clearly, quickly, with all the information you have, make the best decision, and then know how to use the equipment and the medication to accomplish what you want. And then you make another evaluation and you decide to do something else or take that away and try something new. All of that is a very important skill or a set of skills that need to be taught to you. And that's why it's going to be awkward in the first half of this class. So practice these things under the stress of a class or in another group where you're taking a de-escalation test. There are different courses that offer patient mitigation, de-escalation, and so forth. So police take them, and we can take them if we want to as well. How would you de-escalate a situation when you're facing somebody that's got a knife or is about to jump off a building? These are important things to keep in mind. Are you going to be able to critically think on these calls? Do you know how to talk to somebody, how to stay calm, how to reach the person beyond the patient? Can you communicate well with them and the people on scene to keep the situation calm? How about using your radio to call in additional resources? Do you know how to phrase what you need and tell them where you need them to be and how fast? Do they need to be there with lights and sirens? Can they take their time? If it's something that you need to say while still monitoring the room for safety, you need to be succinct, quick, precise, and then get your head back into the situation. Using radio, communication is a very important thing to learn right off the bat. These are things that you really will need to practice, and it's stressful, and it's good to be stressed in some cases. We talk about different types of stress. Well, of course, there's distress, and that's what most people call stress. But consider the fact that in this class, we're going to be working in fake stress built to strengthen your ability to build resilience in your brain to face hard, stressful situations. What about just working out? Those are what we call eustress, E-S-T-R-E-S-S. Eu means usually good. It's a good kind of stress. You're taking the stress on voluntarily in order to create a positive outcome. And that's a really important part of this job that I want you to think about. In fact, it's a very important part of your life to be able to do that. What I'm talking about is figuring out how you can look at the stress of life and accept it in a manner that's going to get you to be stronger, to face and eventually overcome what comes your way. This is the idea of the victor over the victim. You need to be thinking of yourself as someone who is up for the challenge, not someone who has the harshness of life foisted upon them and there's nothing you can do to protect yourself. You have the tools, you have the equipment, and anything that doesn't kill you really does make you stronger. It hurts, but it definitely will make you stronger to go forward. As we talk about this in terms of well-being for the EMT, it's really well-being for yourself. The harder life gets, the more you should say, I'm ready for it. Here it comes. I'm ready. Let's do it. Or I'm as ready as I can be. So let's face it, and I'll learn from my mistakes and keep going. It's a simplistic way of looking at things. It's also a matter-of-fact way of doing it. And it's hard for us to think about, particularly if you've never been fully stressed out, if you haven't had real heartbreak or loss or risk of death. And once those things start to become real, you can see this as something that is not only a beneficial way to face life, it's more of a survival technique that is probably the best way of learning how to face adversity going forward. Think of it as you'd rather be a victor than a victim. And so that's what we're going to get back into here. Eustress is a very important thing to keep in mind. There's somebody who can face eustress, feels good. These are the ways in which EMTs usually manage your stress, how things occur to you. You have this general adaptation syndrome where initially you get the alarm response in the middle of the night, you dump epinephrine into your system, you go to work, you then come off of the job or the call. That reaction then over time becomes normal to you. You desensitize and get a resistance to that sudden alarm, fight, flight response. But eventually it is causing the same dump of epinephrine, different hormones and stress, doing the same thing to your body. You're not as aware of it any longer. And eventually you find ways of managing it. You either learn ways to work out and recover and detox from those chemicals rushing through your body and those thoughts. You learn how to detox or process those, or you begin to get into a state of exhaustion where you just keep compiling things upon yourself. And it's a very dangerous way of living. And it can happen almost without even realizing as you start this career in your first 2 to 3 years in the job, depending on how busy things are. So that acute stress, let's think of that alarm response. When the bell goes off and you are sleeping and you feel the ice water in your belly, that is an epinephrine dump. That's an adrenaline dump into your body that's causing a fight flight response. In that fight flight response, your heart rate skyrockets, your blood pressure increases, you breathe more fast, your bronchial tree dilates, you get sweaty, your pupils dilate, and you're ready. Your fast twitch is there. It's an actually good reaction if you know how to manage it. And if you can detox after you go through that or a number of those per shift. This is why working out is so important. It literally flushes your system afterwards. It's a very rapid onset. Things can linger and there are delayed stress reactions later on. You'll be thinking about that call after it occurs. There was something there that irked you. Oftentimes it's guilt. You didn't think of the right thing to do. You misdiagnosed. You weren't great when things got bad. You messed up in one way or another, and you can't let yourself get over it or process it. This is a real common habit, and you'll notice it in yourselves in the first semester of this class, and you'll see it again during your first couple of years on the job. It's a necessary part of learning how to manage yourself in life after facing major traumas on a regular basis. Don't worry about it. It's all natural and you're going to get through it. But that's what you can attribute the guilt and unresolved thinking, which leads to poor sleep, possibly issues with socializing with people. And then if you don't learn to deal with that, our big concern would be some kind of cumulative stress reactions where now your body goes into survival mode. The metabolism slows. You become sedentary. Oftentimes you gain weight because of the excessive cortisol in your system, another stress hormone that slows things down. If we were living in the wilderness, we're on the run for our lives. That's why we're getting this fight flight reaction. So clearly we're not comfortable in our place. And we're constantly binge eating. You'll notice that you eat heavy foods beforehand. It's that same mindset of who knows the next time I'm going to get a meal. So your body's cravings increase during prolonged or cumulative stress reactions. The excessive cortisol causes weight gain, a slower metabolism, a feeling of loss of joy, and really just kind of living day to day, oftentimes a little bit jaded about life, not sleeping, demoralized, depressed. You're complaining about other people. You start to become the victim, don't you? If you notice that, it's a common reaction. It doesn't mean you're a bad person. It means you will now see the terrain you have to traverse to get to a better means of managing your stress if you plan on staying in the job. And it can be really tricky because we're dealing with critical patients on a regular basis, very often. And it's a lot often than the normal public would believe. So that changes, it puts us in a different category. When you're dealing with these patients, you have to consider that they're critically injured and they may die and they're scared out of their wits. So it's up to us to not only treat their injuries and keep them stabilized and alive to the hospital. Also, you need to be able to talk to them in a manner that keeps them stable mentally so that they don't make their situation any worse as they're freaking out. Heart attacks don't do well when you make the patient panic. Keep them calm. They are less likely to go into cardiac arrest. Speak calmly to your patient. Find out their name, especially on a serious call. Use their name regularly. And anytime they're asking how I'm doing, say, right now we're doing everything we can and you're talking to me. This shows that you're in good shape and we're going to manage this all the way to the hospital. You stay with me and we'll keep talking. And chances are you're going to be okay. We're thinking in the back of our heads, you have that hour from injury to surgery. If I can get them in there and they're conscious, they got a good chance for survival. Be honest with them. Update them regularly on the call. Tell them what you're doing. It's very chaotic when you're putting a person on a backboard, strapping them up and carrying them over to a gurney. Explain to them what you're doing. Update them. Hey, we're putting you on a backboard. We're going to roll you to your left. Don't worry, roll you down. We got you. You don't have to help. Now we're going to pick you up and put you on the gurney. What's going to happen when we get into the hospital, Mike, is we're going to wheel you in. I'm going to give them a big presentation about what happened to you, what we did for you, tell them all the injuries that I've found so far, and I'm going to move you over to the bed, and then they're going to take off with all of your care. And it's going to go a little bit chaotic, but that's normal. I want you to understand that. Is there any information you want to pass along to me that I didn't get before on this call that might be important to know when I walk into the hospital and tell them? Okay, so let's just get this straight again. You're in your car, you were restrained, you're doing 45 miles an hour, and I go through the call with them, and they go, that's it. Anything I miss? Oh, I forgot to tell you that I've had a couple of drinks. Okay, good to know. We'll see how, we'll work that out when we get there. Or, oh, I'm a diabetic and I didn't take my medication. Oh, okay. Well, let's check a sugar as we go. It's important that we get the story straight. We tell them what's going on and we hand them off with the best possible chance of survival. And we're doing anything we can to treat them and ease their pain. They want to call their parent or their loved one. Let them call or tell them that you will do it, depending on the severity of the call. Death and dying is a very real part of our job. It occurs on sudden terms during accidents and suicides and overdoses. It can happen long-term, drawn-out suffering like cancer or ALS, someone who's bedridden, where you see this family going through the machinations of misery. And we bear witness to all of it. We are going to be there to treat them, to potentially save lives. Ideally, we end their suffering in some means, or we bear witness to this by talking with the family, sitting with them and speaking with them. A lot of this job is sharing the moment with the family, especially if this is a patient that died maybe hours ago and there's very little we do on scene to ensure that there's nothing we can do, and tell them, now we're here on scene. What would you like us to do? Can we cover the patient up? Would you like a moment with your husband? Talk to them, maybe even call a few people, the neighbors, have them come over and start the process of calling people. That's important. We're part of the community. Act like it. That 12-hour period of time that you're working, let the person be the most important person in your life. I can't tell you the reward you get from that. When you're dealing with these things, it's very difficult, especially as a young EMT. You're not going to know how to manage all of this. Pay attention to the people on your crew that manage this well and use it in a way that helps you get better at your job. So realize it's inevitable to deal with this. and that we're going to be seeing things like death, dying, children dead from SIDS or car accidents. There's nothing you can do to pacify a parent who's lost a child. Be there to help in any way you can, and understand that we'll go over that in a moment. The big concern is we have to be aware they've just had a massive life change and that we need to help them in any way possible. There are the 5 stages of grief and dying that you will see occurring. In fact, you may have already felt in your life: denial, anger, bargaining, depression, and acceptance. They are all part of the process of loss or death or heartbreak. And they don't always have to be about death. They don't have to be in that order. And they don't have to just be a one and done. Oftentimes you revisit it. You go over the anger again and again, and the bargaining becomes a shorter period. Just let me make it to my kid being 25. Just let me make it to my kid getting to college. Just let me get through my kid's graduation. We continue to use these 5 stages of death and dying in order to cope with the ununderstandable, the immutable. We don't know what death is. So we throw everything at it. All the emotions go towards that. And who's to say, what it is, but this is the normal body's process of facing something that it doesn't understand. When someone has died or someone you're speaking with, you're trying to console them, think of things like, I'm sorry for your loss. If they get mad at you and they feel off, emotionally off, it's okay to be angry. I can see that you would be angry with this. I know they're not angry at us. So it's all right if you're angry. You can be angry at me. That's okay. Must be hard to accept. That must be painful. Tell me how you're feeling if you would like to. And of course, it's okay to cry. It seems like people were very fond of your husband. What we do want to do is make sure that we don't go into compassion fatigue, which is when people are checking out. They're no longer willing to sit with that patient and be a patient advocate and help them through life. And so when somebody becomes salty, we call that an old salty dog. He's a guy's worked here 25 years. He's checked out. That's one way of handling things. It's not the way I recommend whatsoever. It's certainly not how I want to end my career. Anytime I've had to leave or have a serious trauma, I've actually put more on my plate in order to manage it. I feel like it's a better way of dealing with things. And if we're dealing with somebody like that, pay attention to your own emotional state. Realize that you're checking out, that you're having a lack of empathy, and that maybe it's time to start speaking with somebody and seeing what's going on. Depression and suicide are a very real part of this job. The average person sees 2 or 3 traumatic events in their lives. And for EMTs and caregivers and emergency responders, somewhere around 750. So just imagine the difference in our mindsets between us and the regular public. That takes a tax on us, and it can be a considerable stress. And if we don't learn to manage it, it's going to get the better of us. Be aware that these things happen and they have to be worked out. Seek out and ensure employees are connecting with mental health services. And that means yourself. That means insisting that your partner, your crews, speak to somebody. If you notice them getting angry, withdrawing, drinking, being excessively depressed, talking about suicide, making plans, do not overlook that and say it's not anything to worry about. The worst thing you can do is ignore it. And then when something happens, have to live with the fact that you knew it was going to happen, or they had talked about it and you knew something was wrong all along. This is some other idea about being a victor versus a victim. Well, let's watch a couple of videos regarding this victor versus victim mindset. This is based on what's called exposure therapy that started in the 60s.
If people are exposed accidentally to a stressor and they're phobic, that tends to make them more phobic. But if they're introduced voluntarily to a stressor of the same magnitude, then the introduction of the stressor is curative.
Go a little deeper on that.
So imagine that as your courage grows so that you can confront more and more of the horror of life, that a spirit begins to develop within you that gives you a strength that's commensurate with your daring. That's walking with God. That's the same thing. So the promise is that if you had the courage, something would be with you to allow you to bear up nobly under the burden. And all the clinical evidence supports that proclamation, because what you see in people in the therapeutic transformation is that insofar as they're willing to confront what terrifies them voluntarily, they get stronger.
Studies show that facing fears head on not only reduces anxiety, but also builds mental resilience and personal growth. In therapy, this is known as exposure therapy, where patients gradually face their fears in a controlled environment, leading to significant improvements in their well-being.
So taking this stuff on with the foreknowledge that you are about to face something gets you stronger in the long run and able to cope with the immediate adversity on more of these.
So if you can face something voluntarily rather than having it chase you, it's way better for you psychophysiologically. So that's partly why, well, it's worthwhile to go find the dragon in its lair instead of waiting for it to come and eat you. So, and especially when you also add the idea that if you go find the dragon in its lair, you might find it when it's a baby instead of a full-fledged bloody monster that is definitely going to take you down.
So that's a very important point to take a moment to think about. Going into this with the foreknowledge that you're going to see a lot of difficult things. When you hear the call, brace yourself, get ready for that. You'll know it when it comes out. The first time you go on a cardiac arrest, you're going to go, here it goes. You're getting yourself ready for that. And you'll get through it. You'll process it. And there's enough of these in the job that you will be affected. Nonetheless, you can build up a kind of courage, a resilience to it. And the best way to deal with it is just to suck it up and get to work, get it done. It's that old saying from Winston Churchill, if you're going through hell, keep going, don't stop. And it's very important in our job that once we start, we're dispatched, get it done. We'll talk about it afterwards, but don't linger in the mire. Let's talk about some do's and don'ts. Don't drink yourself into excess in an attempt to avoid the trauma. Don't use drugs, and pay attention to yourself. If you notice you're starting to distance yourself from others, showing signs of PTSD, post-traumatic stress disorder, you're showing signs of being angry, irritable, quick-tempered, complaintive, more than you ever have been. Also, be aware of your partners and your crew members and the people in the station and other people on shift that they're not showing these signs. And if they are, get them some help. Don't let it get to self-destructive behavior, showing up to work drunk, driving drunk, which is very common. Drinking tends to be more of the issue with firefighters and EMS and police rather than drugs, but it's still common to see drug addicts as well. It's a functional alcoholic. People can last longer and continue to maintain relatively on the job, not so much with crack or cocaine or heroin. Pay very close attention to your sleep and your fatigue. It's incredible how much sleep is important for us. The National Sleep Foundation recommends 7 to 9 hours of sleep each night. On average, fire EMS crews get less than 6. And it's usually on a busy night, you get 2.5 to 3 hours. You're up 2 or 3 or 4 times that night. At some point, you just go say, I'm going to stay up. We'll just watch the sun come up. And that's the way things go. What's incredible is when you see these firefighters retire, and in about a month to 6 months, they come back and they've lost weight. They're smiling, they're happy. And people go, what happened? They said, I just slept. I was totally sleep deprived. And once you reset your body, metabolism speeds up, you become less of a survival animal and you become a flourishing, thriving animal. It's amazing. So try and get 6 hours of sleep. If you have issues falling asleep, if things stay on your mind, if you feel that you're stuck, or you will have a tendency to be in that delayed stress reaction, you should read this book by Matthew Walker. It's called Why We Sleep. It goes into the detoxing of ADP that occurs when we're sleeping and how necessary it is for your cerebral spinal fluid to drain all of this waste product that's accumulated over the day. If it doesn't happen, you start to see that on the body, on the face, on the mind, on the mental aspects of your body, literally on your own health. Within 2 or 3 days, sleep deprivation can cause massive effects. And it's important to be aware of that going forward. Find some ways to exercise every day, something, for anything from stretching to yoga to running to jujitsu, dance, whatever you've got that you like doing, find at least a little time during the day to move your body. Change your attitude about the stressors. This is that attitude of saying, all right, I'll be a part of this world. Taking on that trauma voluntarily, dealing with the trauma and not holding on to it. Try and find a good family and a group of people you can be a part of, someone you can go spill your guts to, cry to, complain to, commiserate with. But eventually, at the end of that conversation, it should be a catharsis. You feel better. You haven't dug deeper into the trauma. You've let it go. In the best marriages, that's your spouse. In the best relationships, that's your best friend. It can be your family, can be a group of people. Oftentimes for firefighters, it's the crew they work with every day. When they come back from 4 days and when they're meeting around the table, that's your catharsis. And it's more important than you would imagine. It's couched and almost disguised as mealtime. It's family time. In fact, a lot of firefighters call it family time. And a lot of stuff gets discussed, especially if you're in a good crew. You find people that are kind of a touchstone, if you will, somebody that gets you in the midst of the chaos that you're going through on the job and even at home. You have somebody there that you can be like, this is getting tough, dude. That's important. Find that group of people and hang on for dear life and make sure they have that with you too. Some other things that I always say, I try and run. In fact, I pretty much do every single day. I was never a runner. I am now. I process everything all day. I need it to flush my brain, and I run with my dog. That's our time. And I find the time to do that every day. But it can be something else for you. Find something that works for you. Get a good group of friends you can goof off with and have fun. My very important thing is to find a passion. Find what it is in your life that really gets you turned on. Something that gets your heart pumping. It gives you that good fight flight reaction. Like, oh my God, I could do so much with this. And it pulls you in. Even better is when you're doing it, like playing music or running. You can just lose yourself in it for a while and come back to a different state of mind. Man, once you find that, there's nothing better. Look for that. This is the time in your life that you'll find it if you haven't already. I bet you have an inkling of what it is already. Start digging into it, especially now and into college. It really is the spring water of your soul and your heart. And if you can find a way to use that as some part of your career in your life, there's an adventure right there that is worth all the tribulation. If you're stressed out, go to a busy station, work in a busier department, work in a place where there are more calls, because what happens is instead of being stressed out by goofing up on a call, you don't have time to think about it. 10 minutes later, you're going on another call. And whatever you messed up on, you can fix. 5 or 6 or 10 calls down the road, you're going to have that call again, and you can correct what you did in a relatively short period of time. And that allows you to see your own improvement. When you can really put yourself under the gun and rapidly improve, that learning curve gets so much better, so much quicker. It will give you an amount of confidence to really step into the job and make that leap of faith and that leap of saying, I'll take this on because I can see that I'm getting better. You'll also note that people that work in busier stations tend to be cooler people. You have to be. You have to be level-minded. You have to be not so involved in your own chaos so that you can deal with the external chaos. And so that requires you to be a little bit more centered, a little less concerned with yourself and your personal life, and able to kind of focus on the external world. And those are the crew members you want to work with because they're good at talking to you about your stuff and they're good at managing big events because they're not letting it get into their head. It's not part of their life. It's a really beneficial thing to be into. What you're going to notice is that it's hard to get into that group. They're going to push you. They're going to razz you. Hopefully, they're going to prank you. That's part of the indoctrination. That's part of getting to be a part of that crew. They all went through it. And if they're doing it for you, that means they like you. And that's what you want. You want a crew that screws with you a little bit. It's really fun. Trust me. And you talk to any of the firefighters here that teach the classes. It's exactly what you want. You want to be hanging out with your buddies. It's wonderful. We're given a whole lot of tools and toys and money, and they go, hang out. And then as long as you save these people and you fight this fire and you go to that car accident, you can hang out with your friends. And that's exactly what we do. Find a busy station, hang out with your buddies, and then get to work. And then it's almost like being in a rock band because you're better than your own parts. You're higher, you're more important than the sum of your parts. You're greater than the sum of your parts. There's a harmony. There's a dynamism to your crew where you can finish each other's sentences and you kind of amplify each other's talents. And it really is a beautiful thing to fight fires with, to extricate patients using heavy rescue equipment, because you're really there almost in the same mindset. You see what they're doing and you know without asking them the strategy they're going about, and you can already anticipate where you should be to take the patient or to cut the next piece or to make sure that when they open that door, you're ready with the hose line. There's really cool moments in the job that come from being with people that are good at the job, that you understand, and that you get along with. So Jordan Peterson was talking about that idea of courage, resilience, that idea that you fight the dragon. If you think of the old myths of the, things in the Bible, if you don't want to think they're myths, let's take the dragon myth. You have to slay the dragon. The dragon, usually outside the village, lives on the hill. Everyone's afraid to face the dragon except one person. And the dragon has something that the village needs. Medicine. It's got a magical potion to save the village from the illnesses it has, or it's got a golden fleece, or the queen or the princess is trapped there. And the one that's brave enough to face the dragon can bring back the tonic or bring back the dragon's tooth to save the society or the culture of the village. You look at what firefighters do. We go into burning fires when everyone's running away, with the understanding that if there's someone in there, we will save them, followed by their property, followed by stopping the fire from getting any bigger and taking anyone else's house out. And that's our job. We are going in and trying to fix the problem and getting into the den where no one else wants to, and showing how strong and courageous we are. Even when we're scared to death, even when things start to get nasty, we're ready to go. And that's, if you can, it sounds corny, but don't we all kind of like the corny adventure story anyway? Don't we really? Who doesn't like Star Wars, Indiana Jones? Who doesn't like those ideas of that hero? Something speaks to us in our hearts. Otherwise, we wouldn't have that myth. So What I'm asking you to do is lean into the myth. Be a little bit pompous, a little bit exorbitant when you think of what you're willing to face. Have a little inflated ego and just be ready to get that thing deflated over and over again. That's the fun part of life, is thinking you're big. Somebody shuts you straight down. You go, damn it, I am not that good. And then you work your way back up. All of that is training to be strong, to be courageous, to face real adversity. It's just we're imperfect beings trying to do something immense, and we do it by trial and error. And that's okay. That's why we're in this class. When you start feeling like, I can't do this, I'm scared, keep going. We'll finish this up. Resilience is the capacity to cope and recover from the stress. And you will. You will be able to face the dragon. You'll be able to manage the trauma. As long as you're choosing the right battle, then you know you can do it. If it's something that your heart is getting called to do it. And realize it's going to be hard, but that's the fun of life. So choose that battle. You get to choose what it ends up being. Stay healthy and safe at all times. Always be watching your behind you, your six, as military call it. Keeping the corners of the room surveyed, looking around. Make room for your enjoyment in life. Face adversity with courage and calm. Learn to manage your emotions. Now, try and breathe through the stressful times. Think clearly through things, de-escalate problems, and communicate clearly. Prioritize and manage these big traumas in your life with the appropriate time and attention that they deserve. Don't avoid these bad thoughts, but don't obsess on them either. And again, it's not just a choice. It's a practice of learning how to do all of that. In the end, you will have to shoulder some load. I don't know how religious people are. I'm not necessarily that religious, but it is true that God told Adam, you will have to toil. That is life. Life is you're going to have to work. You don't want to not have to work, by the way. What would we do with our time? It'd be ugly. It would be boring, and we wouldn't be human anymore. To be human is to be burdened by life, but to find beauty in the burden and to do some kind of art or poetic performance of our burden, of our job. You can take it on like a victim. You could have the weight of the world on your shoulders saying, oh, I thought my backpack was heavy, but this is all the stress and the trauma. Or you could be top dog, slamming that world, saying, what else you got for me? I can do it, and I will keep doing push-ups until I can't. And then if I'm still around, I'll keep going. Really, the best pursuits in life, including this job, even though it will scare some of you to face these things and manage people that have had loved ones die and children die, and you might be in a life-threatening emergency. But if you have that inspiration to do this job, it's worth it. It's fraught with peril and challenge, but it's really the best thing that I've found, aside from jumping up and playing music in front of thousands of people. That's a hell of a lot of fun. Saving lives, one person at a time, is amazing. Sometimes it's a grind. A lot of times they're doing just day to day in and out. It's like Sisyphus pushing that boulder up the hill, and it rolls back down, and you got to go roll it back up. But that's the grind. Sometimes it's a real emergency. That ball's chasing you down the hill, and holy God, you better be careful. And again, it's a pretty outrageous adventure. Things to keep in mind are be smart, rely on your training, always be on the lookout. If you can fix a problem, fix it earlier than later. Watch out for the safety of yourself and everyone else. Then choose to step into that adventure. Choose the path that you want. Once you get started, you never go back, and it just gets better all the way through. That is what makes a well-adapted human being. That's what makes you bloodied, scarred up, but smiling at the end. That's where you want to be. You're not going to end without a scar, but damn, each one of them tells a story, and you want to have good stories towards the end. At least I do. Anyway, that's the end of this story. If you're excited for the next one, We're going to go over ambulance equipment. A lot of it's going to be in class because you can't lecture on how you move a person around. So I'll show you some images and some videos, but really that will be for class. And then next week we get into medical legal. It starts to become a little bit more academic. If I've got you so far, wait till next week. It gets better. The last hurdle is that what if I jump in and help somebody and they sue me? Well, that's what we're covering next week in medical legal. And again, it's the same mindset that I'm teaching you here. If your intentions are good and you're willing to face the maelstrom, you're going to be okay. And in fact, you're going to come out looking great. You're going to come out smelling like roses. All right. Take care.